السلام عليكم. اليوم بهذا الفيديو راح أكمل لكم الجزء الثالث والأخير من محاضرة orofacial pain. In this part I will talk about the occipital neuralgia and the type of the vascular pain, the most common type of the vascular pain, also the psychogenic pain, and finally the refferred pain. First of all, I will talk about the occipital neuralgia. Occipital neuralgia, as we remember from previous video, the most common type of neuralgia, trigeminal neuralgia, glossopharyngeal neuralgia, and postherpetic neuralgia. Then the occipital neuralgia. This occipital neuralgia, it is the rare neuralgia. Neuralgia in the distribution of the sensory branch of the cervical plexus, most commonly in the neck in the occipital region. The most common cause of this neuralgia, trauma, neoplasm, infection, the distribution of the affected nerve. As seen in this picture, the pain unilateral in the occipital region above the neck, throbbing pain, electrical pain. It is very rare neuralgia. The treatment of this type of neuralgia, corticosteroid and blocking of the nerve with local anesthesia can also be effective. Then, the other causes of the orofacial pain, the vascular pain. The most common type of the vascular pain, migraine, blister headache, and temporal arteritis. Migraine. Migraine is severe unilateral throbbing headache that is frequently accompanied by nausea, vomiting, which may occasionally cause pain of the face and the jaw. Unilateral pain, unilateral headache. It also affects women more than men above the age of 50 years. The trigger of this pain, the stimulating factor of this pain, such as food such as nuts, chocolate, wine, also stress, sleep deprivation, or hunger, and it's more common in women. This is the stimulating factor of the migraine pain. This is the most common type of headache, vascular headache, the migraine, أو ما يعرف بالشقيقة. The patient characteristically lie down in the dark room and try to fall asleep, as seen in this picture. Patient try to fall asleep in dark room. Why in dark room? Because up to 1/3 of the people have an aura. The meaning of aura, typically a short period of visual disturbance, which signals that the headache will soon occur. Visual disturbance. This is precede the headache, the unilateral throbbing headache. Precede the throbbing headache, visual disturbance, as seen in this picture. This occurs with little or no headache following it. The etiology of this vascular pain. The classic theory is that migraine caused by vasoconstriction of intracranial vessel. This vasoconstriction causes the neurological symptom, throbbing pain, followed by vasodilation. Vasodilation, this results in bounding headache. This is the most common theory in the etiology of the migraine, vascular pain. The treatment of this type of vascular pain determines the common food trigger migraine. This common food trigger migraine should be avoided, so determine the most common food trigger the pain. Minimize the stress as possible by relaxation technique. Also, the drug therapy may be used either prophylactically to prevent the migraine attack, including propanol, verapamil for difficult cases that don't respond. For safer drug, monoamine oxidase inhibitor such as phenazine can also be used. This is the trigger factor for migraine pain such as wine, chocolate, nuts, cheese, processed meals such as fast food, sleep disturbance, also traveling, stress, bright light, odor, weather change, after menopause. These all the trigger factor of migraine. The initial treatment for those mild to moderate symptom. Mild to moderate symptom, simple analgesic can also be effective. Aspirin, paracetamol, non-steroidal anti-inflammatory drug, all these can be effective. In severe cases, moderate to severe cases, those patients don't respond to the simple analgesic. We can use ergotamine and sumatriptan. This is effective for the both pain and nausea. Nausea that can be given orally, nasally, and rectally, because this type of pain preceded by nausea or vomiting. For those severe cases, we can use ergotamine and sumatriptan. But this advantage of these drugs, these should be given cautiously, because can cause side effects such as hypertension and other cardiovascular complications. Another type of the vascular pain, Blister headache. Blister headache is the type of the pain syndrome characterized by episode of the severe unilateral head pain, occurring chiefly around the eye, as seen in this picture, around the eye, frontal and temporal region, as seen in this picture, frontal region, temporal region, around the eye, and also maybe starting in infraorbital region. 80% of the patient are men between the age 18 to 40 years of age. So the blister headache, this type of pain occur mostly in men in middle age. In contrast with migraine, migraine occur above the age 50 years and most commonly in women. This is blister headache most commonly in men. The term blister is used because the patient has multiple headaches per day for 4 to 6 weeks, and then may be without pain for months or even years. Patient suffering more than one attack, several attacks per day, and most commonly in the night. Each attack lasts 15 to 20 minutes. As seen in this picture, for extreme intensity may last 1 to 2 hours, mainly in the night. The clinical manifestation of this vascular pain, the attacks are sudden, unilateral, and stabbing, causing the patient jump, cry, or even strike object. Because the patient described the pain as hot metal around the eye. In contrast, in the behavior of migraine, as you remember, migraine patient need sleep, dark room, silent as possible. But these type of vascular pain, patient may jump, cry, strike object. This is in contrast of the behavior of migraine patient. The etiology of this pain, the exact cause of this blister headache is unknown, but the blister headache suggests that abnormality in the body biological hypothalamus play an important role. Defect in the hypothalamus, the most common etiology of this type of pain. Unlike migraine, the blister headache is not associated with the trigger factors such as food, nuts, or hormonal change or stress. The trigger factor, drinking alcohol, may trigger this type of headache. Other possible triggers include the use of nitroglycerin, that drug used to treat heart disease. These nitroglycerin or alcohol can trigger this type of pain. The treatment of blister headache, because it occurs at night, an acute attack of a blister headache can be aborted by breathing 100% of the oxygen. Patients keep this oxygen cylinder at bedside. This is as the first sign of attack can be used oxygen. Injection of sumatriptan or sublingual or inhaled ergotamine may be also effective therapy. For those severe cases, the lithium also effective therapy. For those patients not respond to the sumatriptan or ergotamine or not tolerate the side effect, can be also use lithium. But these patients take lithium as long-term may be monitored for renal toxicity. This is another disadvantage of this drug, renal toxicity, especially for those patients long-term use of the lithium. Other drugs are useful for preventing attack include ergotamine, prophylactic prednisone, and calcium channel blocker. Also, these effective. Another type of the vascular pain, temporal arteritis. Temporal arteritis is an inflammatory disorder involving the medium-sized branch of carotid artery. The temporal artery is the most common. The etiology of this temporal arteritis, from its name, the etiology immunoabnormality, inflammatory disorder that result in inflammatory cell infiltration in the wall of the artery. The clinical manifestation of temporal arteritis usually affect the adult above the age of 50. Patients have a throbbing headache, accompanied by general symptoms such as fever, malaise, and loss of appetite. Examination of the involved temporal artery, as seen in this picture, reveals thickened wall of temporal artery, thickened pulsating artery. Also, mandibular and lingual artery may be involved. Throbbing pain in the jaw or tongue may be an early sign of this inflammatory disorder. This occurs because immune abnormality. A serious complication of this type of pain is in an untreated patient is ischemia of the eye, which may lead to the sudden blindness. These visual problems may be prevented by early diagnosis and quick therapy as possible. Laboratory abnormality include an elevated ESR and anemia. ESR, erythrocyte sedimentation rate, most commonly increase in those patients with inflammatory disorder, with systemic inflammatory disease. So this due to immune abnormality, this is an inflammatory disorder, so the ESR is elevated. Also, the patient with elevated ESR suffer from anemia. Most effective diagnostic test is biopsy from the involved temporal artery. As seen in this picture, biopsy from the temporal artery. This is the normal temporal artery, this normal wall. In the biopsy, this is the temporal arteritis, infiltration of giant cell, inflammatory cell, in the wall of the temporal artery. The treatment of temporal arteritis, corticosteroid, typically high-dose prednisone, must be started as soon as the diagnosis is suspected to prevent irreversible blindness, secondary of the ophthalmic artery occlusion. The initial prednisone dose is 40 to 60 mg per day, and the steroid is tapered when the signs are controlled. This is the initial dose, and then the dose tapered when the signs are controlled. We should start the treatment as possible to prevent the reversible blindness or irreversible blindness. The other type of pain, psychogenic pain. This is other causes of the orofacial pain, the psychogenic pain. The psychogenic pain include atypical facial pain, atypical odontologia, and burning mouth syndrome. Atypical facial pain. This type of the pain is the chronic facial pain. Does not meet any diagnostic criteria. Does not also respond to the treatment. Does not respond to the treatment. Pain is not simple sensation, but described as an unpleasant experience. Patient describe facial pain, unpleasant experience, without any cause. Also, this pain can change its nature. The etiology is unknown, but it could be neuropathic or psychogenic or both, or also myofascial pain. The clinical manifestation of this type of pain, the major manifestation is constant dull aching pain without apparent cause that can be detected by examination or laboratory. All these normal. Clinical examination normal, laboratory examination normal. This is the most frequently in women in 4th to 5th decade after menopause. The patient may report that the first onset of pain consists dental procedure or medication. but the patient reports taking multiple dental procedures to treat the pain. These procedures result in temporary relief, but the pain returns day or week without any cause. The pain may remain in one area or maybe migrate spontaneously to other area after this surgical procedure. Symptom may remain unilateral or involve maxilla or mandible. This is atypical facial pain without any cause. All the diagnostic, investigation, all normal. Clinical examination also normal. The treatment of this type of pain, patients should be told about the nature of the disease. This is very important. Tricyclic antidepressants such as amitriptyline given in low doses are often effective in reducing the pain. Atypical odontology. Atypical odontology, this is less common than atypical facial pain. From its name, odontology, meaning the pain on the tooth, in one tooth or in the row of the teeth, which are either said ache to be sensitive to the heat or cold or pressure. But the tooth is normal, no caries, no other disease. If no organic cause can be found and the treatment is ineffective, psychiatric assessment is very important, is needed. If there is the treatment ineffective, no abnormality, no any other disease. Treatment, the symptoms should be taken seriously. Patients should be reassured that don't have any life-threatening disease. Consultation is very, very important. Consultation with otolaryngist, neurologist, psychiatric, may be also all these helpful to exclude all causes of this pain. Tricyclic antidepressant also is very effective, such as amitriptyline and dexapine given in low doses. Other recommended drug, gabapentin, also effective. Some clinicians report benefit from topical anesthesia or topical doxypine. Also may be effective. Another psychogenic pain, burning mouth syndrome. This term describes oral burning with non-detectable cause, non-inflammatory or ulcerative disease of oral mucosa. Women experience symptoms 7 times more frequently than men, particularly in postmenopausal women, without any cause, burning sensation. The sign and symptom of this burning sensation: dry mouth, increased thrust, also metallic taste after eating and after brushing, pain, burning or burning sensation in the mouth, change or loss of the taste. This is the sign and symptom of burning mouth syndrome. The etiology. The cause of this syndrome remains unknown, but a number of factors have been suspected to be included, such as hormone and allergic disorder, anemia, salivary gland hypofunction, psychiatric abnormality, also depression. This is the etiological factor of this burning sensation. Also, chronic low-grade trauma resulting from parafunctional habit, such as rubbing the tongue, as seen in this picture, rubbing the tongue across the teeth or pressing it on the palate. This is the etiological factor, the most common etiological factor of this burning syndrome. The clinical manifestation, the burning symptoms don't follow the anatomic pathway. Without any anatomic pathway, without any cause. There are no mucosal lesions. When we examine the mouth, there are no mucosal lesions or no neurological disorder explain the symptom. The tongue is the most common involved. The burning can be either intermittent or constant, but eating, drinking, or placing candy or chewing relieve the symptom. This in contrast with neuralgia. Neuralgia, patient with neuralgia, to differentiate from neuralgia or lesion affect the mucosa, candy or chewing gum not relieve the pain. But in this burning mouth syndrome, candy or chewing gum relieve the pain. This in contrast with neuralgia, because this neuralgia don't relieve the pain. The treatment, the patient should be reassured of being the nature of the disease, of nature of the symptom. Patients with severe symptom often require drug therapy tricyclic antidepressants such as amitriptyline. Burning of the tongue resulting from parafunctional habit may be relieved with the use of the splint covering the teeth or palate as seen in this picture, especially for those patients with a clenching at night. So splinting, covering all the teeth and palate, that relieve the pain or relieve this burning sensation. Finally, the other type of orofacial pain or another cause of the orofacial pain, referred pain. Referred pain to the mandibular region from many causes, such as one of the causes ischemia, myocardial infarction, cardiac ischemia. This is referred to as cardiac toothache and is characterized by pain provocation or the pain increased by physical activity. Referred pain, mandibular pain, pain to the jaw in the left side, mandibular pain or tooth pain. This led to the cardiac pain. This pain relieved by rest. This is meaning the referred pain. إلى هنا كملنا الجزء الثالث من هذه المحاضرة. أتمنى استفدتم منها. In this lecture, I talked about the most common causes of the orofacial pain. It is very important because our responsibility as dentists to recognize or to be occupied with diagnostic skill to reach the accurate diagnosis. You can differentiate between the many types of pain, because pain can be divided into the psychogenic pain, neurological pain, dentoalveolar pain, musculoskeletal pain. So the role of this seminar or this lecture to help the dentist to differentiate between the most common type of orofacial pain or the most causes of the orofacial pain. Because people, when suffering the orofacial pain, they call their dentist. In our clinic, we see patients every day for pain. Sometimes, or some patients suffer from severe pain, others from simple pain, acute or chronic. So we see in the clinic every day patients suffering from pain. So our responsibility to be occupied with diagnostic skill, to differentiate between different types of pain, to reach accurate diagnosis and prescribe appropriate treatment as possible. شكرا لحسن استماعكم. أتمنى استفدتم من هذه المحاضرة. إن شاء الله ألقاكم محاضرات أخرى في مختلف مجالات طب الأسنان.